The hamstrings are four main muscle bundles known as the semimembranosus, semitendinosus, and the biceps femoris, which has two heads. Most of these muscles cross both the hip and knee, making them responsible not only for knee flexion, but occasionally for hip extension. The hamstrings have a propensity to be both overactive and overstretched, making them targets for tiny strains or tweaks with high-intensity endeavors. Athletes with back pain should treat their hamstrings as well, since the back muscles are actually attached to the hamstrings through fascia. On page 3 you can see this. It's a system we call the posterior chain. Also, when the hamstrings are too tight, bending forward to do a deadlift will compromise the low back and make the muscles work harder than they should. The hamstrings are unique in that in certain circumstances, no matter how much you stretch them, they'll never lengthen. If your hamstrings are always tight, then you should consider treating the hip flexors to fix your anterior pelvic tilt. Learn more on page 25. Trigger points in the hamstrings typically cause pain behind the knee, possibly extending into the calves. To test the hamstrings, lie flat on your back. Flex the hip 90 degrees with the relaxed knee. Brace the leg there by interlocking your fingers and holding the leg in 90 degrees of hip flexion. Now try to straighten the knee all the way while keeping the hip at that same degree. A positive test will be an inability to straighten the knee completely. To set up hamstrings bar rolling, place a weighted bar on the rack at about mid-thigh height. Place the hamstring onto the bar and put some weight into it. Scan through to find the areas of most tension. Straighten the knee in and out a few times in a pin and stretch fashion to add length to the fibers. Move the lower leg around in circles to attempt to mobilize across the fibers. Both methods are helpful. You can do this whether the hamstrings just feel tight or you feel an actual tweak. It's always a good time to treat your hamstrings. You can modify this mobilization by grabbing a mobility ball and sitting on a plyometric box with the ball under your leg on the spot you want to mobilize. Straighten and bend your leg with this contact to floss the adhesions away, just like you just saw. I love this move to fix hamstrings before deadlifts or any lift from the floor. To set up hamstring flossing with the band, you'll need to attach a medium tension band to an upright at about thigh height. Step into the band so that it is somewhere between the top of the hip and the middle of the thigh. The lower you place the band, the more tension you will create on the hamstrings. Take a giant step forward to put some stretch into the band. The treated leg should be staggered slightly in front of the non-treated leg. Place your hands on your legs to help take the pressure off your lower back. Use your hands to move the knee in and out as shown. You should be rocking the knee to the inside and extending it. Then bend it and push it to the outside and extend it again. Repeat in and out, about 15 repetitions each side. If you failed the functional test, this is a great way to stretch and recheck your progress. Again, remember that sometimes the hip flexors need to be treated before any length will come in the hamstrings. To do this hamstrings progressive stretch, find a place you can lay flat. Begin by pulling the hip into just a bit more flexion than 90 degrees as shown. Keep hold of the leg with your hands and make sure it does not move in the next steps. Keep the toe pointed and straighten the knee as far as it will possibly go while holding the hip at the same angle. Keep holding the hamstring stretch as you dorsiflex the ankle, meaning flexing the top of the foot towards your face. Hold this position for a slow count to 5. Now flex the hip a little bit further and repeat the previous steps, keeping the toe pointed and then dorsiflexing for a slow count of 5. Once finished, continue the same process 2 more times for a total of 4 passes, each at a more difficult angle of hip flexion. Hi, Dr. Nick here from MobilityWODShop.com. I highly recommend you grab a nice mobility band from MobilityWODShop to get full mobilization of this area. So click the link that just popped up on your screen and you'll be well on your way to the mobility you've always wanted. Grab your MobilityWODShop mobility bands today. They're high quality and you won't regret it.